Next case, a 7-year-old boy with enlarged abdomen was irritable, lethargic, and frequently hungry. History revealed that his developmental milestones were comparatively slow. Clinical examination showed enlarged liver. Blood parameters were as follows: fasting blood glucose 40 mg per deciliter, which is decreased, that is hypoglycemic status. Serum cholesterol level was increased 300 mg per deciliter. Serum uric acid was increased 8.8 mg per deciliter. Serum lactic acid level was 15 mg per deciliter, which is again increased. Blood pH level was decreased, which is 7.25. There was no increase in blood glucose even after giving IV adrenaline injection. So what is your diagnosis? Looking at the blood parameters or the investigations, there is hypoglycemia, there is hypercholesterolemia, there is hyperuricemia, and lactic acidosis too, with acidic blood pH being 7.25. So with these findings, we can come to a diagnosis of von Gierke's disease. Now, what this von Gierke's disease is? It is a glycogen storage disorder. What are these glycogen storage disorders? These are a group of autosomal recessive inherited disorders, which are also known as inborn errors of metabolism. The glycogen storage disorders mostly tend to affect the liver and muscles, leading to a buildup of glycogen in muscles and liver along with hypoglycemia. Glycogen storage disorders are the defects in the synthesis and breakdown of glycogen. The disorders are either due to defect in enzymes or accumulation of metabolites in the cell, leading to systemic clinical manifestations, mainly like hypoglycemia. Let's see what this von Gierke's disease is. It is a type 1 glycogen storage disorder. It's a rare disorder with incidence of 1 in 2 lakh persons, and it is a autosomal recessive trait. Now, what is the defect over here? It occurs due to defect in enzyme glucose 6-phosphatase, which results in the block in the formation of glucose in liver by glycogenolysis or gluconeogenesis. Now, what are the biochemical manifestations in a case of von Gierke's disease? Von Gierke's disease results in hypoglycemia, mainly the fasting hypoglycemia, lactic acidosis, hyperlipidemia, hyperuricemia, and ketosis. So, how does hypoglycemia occur? Now, we know that glucose is not released from glycogen, and hence there is hypoglycemia. Now here, when I mention it as fasting hypoglycemia, that is because during sleep hours, overnight sleep for 12 to 14 hours in the infant, in the child, what happens here is it is in the fasting state. During the fasting state, the glycogen is utilized for the energy purpose. But here, the last step where the glucose 6-phosphate has to be converted to glucose in glycogenolysis cannot be done because of the deficiency of the enzyme glucose 6-phosphatase, hence results in the fasting hypoglycemia. Now, why do you see lactic acidosis? Now, as this glucose 6-phosphate cannot be converted to glucose in glycogenolysis, it is diverted to glycolysis, leading to the formation of pyruvate and the lactate, which are the end products of glycolysis. Lactate accumulates in muscle and liver, leading to lactic acidosis. Now, why do you see hyperlipidemia? Since glucose is not available for energy, fat is mobilized for energy purposes, leading to hyperlipidemia. Now, why do you see ketosis? Again, there is excessive lipolysis leading to increased free fatty acid oxidation, leading to increased amount of acetyl-CoA, which further can be channeled towards production of ketone bodies. Hence, we see ketosis in a case of von Gierke's disease. Then, why do you see hyperuricemia? Now, due to absence of the enzyme glucose 6-phosphatase, glucose 6-phosphate is not converted to glucose. Now, this glucose 6-phosphate, which is in excess and is accumulated, is diverted to HMP pathway with the production of more ribose, which in turn leads to excess synthesis of purines. Increased metabolism of purines leads to formation of more uric acid, leading to hyperuricemia, which accumulates in joints, leading to pain and gouty arthritis. So here the clinical manifestations can be abnormally slow growth, low blood glucose level with tiredness, sweating, tremor, drowsiness, confusion, enlarged liver, weak muscles, and also can present with gouty arthritis. This was about the cases related to carbohydrate metabolism. Two were the genetic disorders, that is von Gierke's disease, which is a glycogen storage disorder, the type 1, which is due to the enzyme deficient glucose 6-phosphatase, and the other one is the galactosemia, which again is a defective galactose metabolic pathway, and the other two are the diabetes mellitus and the diabetic ketoacidosis. Diabetes mellitus is due to insulin deficiency or insulin resistance, and diabetic ketoacidosis is a case of acute complication of a case of diabetes mellitus. So we know about the management and the investigations what are to be done in a case of in all these cases, and how to diagnose and how to treat the cases. So this concludes the case studies of carbohydrate metabolism. Thank you and have a nice day.